Kicks 105, good morning. It's the Merrell in the Morning Show, and once again, we are doing a takeover here with CHI St. Luke's Health-Memorial, and, we just got through talking to Dr. George Fedone a few minutes ago, and now we welcome on the line with us Dr. Kaywin Carter, Director of Women's Services, St. Luke's Health-Memorial, an obstetrician-gynecologist in practice now for more than 3 decades. And good morning. Thank you so much for joining us.
Thank you. It's good to be here.
Let's go ahead and start off, first of all, and explain your role in the Women's Center at St. Luke's Health-Memorial.
Well, they brought me on board to be the director, and basically for the past few years, that's meant I've had an integral part in planning the new labor and delivery and neonatal intensive care unit, which has been really exciting.
When talking to Dr. Fedone, it's really, I guess, for lack of a better word, neat to see how just a little spark, a little vision, just a little seed can really just grow so huge. And so this project has now been a vision for over 8 years, finally coming true. Can you put into words what these years leading up to this opening have been like?
This is a little bit personal for me too, Danny. I had my son back in 1997. That's going to date me at CHI, and he was born prematurely. And I remember him being whisked off in a helicopter before I even got to hold him. And so, I spent that night worried about my baby at that point, we sent babies to Shreveport, and I was having panic attacks worrying about how my baby was. I couldn't even be there to know he was okay. And over the years, I've had to watch woman after woman go through this, having the stress of having an early baby and yet not being able to be with their baby because the baby was shipped off to another facility. So this is just a huge milestone for us to be able to keep the majority of these babies in town now, and the families can be there to support the women as they go through the healing process. And it's just a dream come true for me as a practitioner to see that my patients are not going to have to go through that anymore.
Now, we mentioned that this is a Level II NICU, and so what exactly does that mean?
That means that we'll keep babies that are usually 27, 28 weeks in gestation and above. Anything below that, of course, those are the severely preterm babies, and they'll still have to go to Texas Children's in Houston. But now we have an open avenue because Texas Children's has partnered with us. We have an open avenue to get these babies into Texas Children's. Before, we would have to call around and see who had a bed, who would be willing to take the early baby. And now we have a direct avenue into the state-of-the-art that can take these early babies that have good track records of saving even these very early premature babies.
I know that you've been quoted as saying this, and so many others, including myself, have had such wonderful experiences, not only at the hospital there, but with the people there at St. Luke's Health-Memorial. And so what added value does a facility like this bring to the staff?
Well, I think it just elevates their ability to care for patients just another level. I mean, we've always had good staff, but anything that we can do facility-wise to increase their skills, to expose them to a higher level of care and newer opportunities to learn, just makes us that much better in providing care for East Texas.
And I know you kind of touched on this about what this partnership with Texas Children's Hospital not only brings to the hospital, but also to the local community. Can you expand a little bit more on that?
Yeah, Texas Children's is just a mecca for all kinds of problems with children of all ages, but especially for babies. If you have a baby that has a heart defect, well, they have the neonatal cardiologist that can take care of that. If your baby has a problem with the GI tract, they have a gastroenterologist that can take care of that. So we no longer have to scramble to find doctors that can take care of these specific problems. They're on staff at Texas Children, and we have access to them now.
And so what about on the flip side? What does this partnership mean for Texas Children's Hospital?
They always are looking out for ways to expand the way they can help the communities that are within their service area. They get patients from all over the country, but they want to provide services for the local people, and we're considered their local network. So they're reaching out to us to be able to better provide those services for us. Their philosophy is to help as many babies and children as they can.
You mentioned premature deliveries. Is that the main area where neonatal intensive care is considered?
Right, exactly. That's the babies that are born before 37 weeks, and that's what the neonatal intensive care unit is excellent at taking care of.
And what would be the anticipated length usually for a baby along those lines?
Usually a baby stays in the hospital until its anticipated due date. So if a baby is born at 36 weeks, then we're probably looking at a 2 to 3 week stay in the hospital. If a baby's born at 27 weeks, then that baby's going to stay in there for a couple of months.
And what type of support services do you offer there at the NICU, at the hospital for parents?
It's really important to note that this is all private rooms so that the parents can stay in the room with the baby while the baby's there. There are all kinds of support services, family group therapy, all kinds of support services with getting the families in touch with other people who have gone through the same things. There is a special room that they can stay in with their baby that once the baby's going to graduate out of the NICU, there's a special room that they can spend the night in that simulates the home environment, so they'll kind of know what's going to happen at home once they get there. So we don't just send them home without having a night or two in our special room that's like a home environment, but they still have access to the nurses if there's an emergency. So it's really well thought out.
Do you have a guesstimate on how many babies that you might be treating, I guess, in a year at the NICU?
Well, we have 8 beds in our NICU, which we currently are delivering about 60 babies a month, and our goal is 90. And 10 to 15% of those babies will go to the NICU. That's how many babies we're having to ship out of town right now. 10 to 15% of our deliveries go out of town. We're going to have that NICU full. I fully anticipate we'll have over 100 babies a year.
Who are the people on the NICU team?
Right now, our neonatologist is Dr. Perupia. He came from the Dallas area, and Dr. Jane is coming in January, and those will be our 2 on-site permanent neonatologists. Right, Dr. Valerie Moore right now is initiating the startup, and she's works directly for Texas Children's also. But we'll have a staff of Texas Children's neonatologists that are here 24/7 supporting these 2 doctors too. Overall, there'll be about 7 to 9 neonatologists that rotate through. But Dr. Perupia and Dr. Jane are our main neonatologists that will be here.
It must, kind of going off script here, it must take a really special, loving type of individual, whether we're talking doctors, nurses, or support staff, to work in the NICU.
It absolutely does. These patients can't talk to you, so you have to be watching them 24/7 and be aware of every little change in their heart rate and just watching all the data as it comes through on the babies. They're hooked up to monitors, and they have all kinds of IV lines and monitors hooked up to them. And very important to communicate everything that's going on to the parents.
Sure.
Because they're right there watching it all happen, and they're an integral part in the care of the baby too. So it does take a very special person to be able to do that. And our 2 neonatologists are just delightful, and they're very patient and calm and just do a really good job of communicating with the parents.
Obviously, the overall goal is to go home with a healthy baby. So is there a plan in place to prepare the families to go home with the baby, or for regular follow-up care and things like that?
Oh, yes. And of course, our pediatricians in the children's clinic will help facilitate that also. They'll be followed by Texas Children's and the children's clinic. But I think the most important thing is that our special room that we have for them to stay in before they go home, to get them used to being in a room by themselves with the baby without all the monitors and everything, because they'll have been used to, for several weeks, that baby being on the monitors and anything, having a signal go off anytime there's a baby. So it's very scary to go home with a premature baby that's coming off all these monitors. And so they have a very special technique that they have, a protocol that they have in place to wean them off the monitors, if you will, and get them used to having the baby at home.
And we're probably restating something we talked about earlier, but this is a new facility now that's available for folks in East Texas. So why should St. Luke's Health-Memorial Lufkin, in partnership with Texas Children's Hospital, be somebody's NICU of choice?
I think just the expertise of Texas Children's is something that the others can't offer. I think that Texas Children's brand is just impossible to beat as far as medical expertise in taking care of your baby. Dr.
Kay Carter, any other points that you would like to make?
I'm just so excited for this to be open, and I can't wait for people to start using it, and I can't wait to see how my patients enjoy not having to leave East Texas to take care of their preterm babies. It's going to be really great.
It is going to be a wonderful addition to the community. Dr. Carter, thank you so much for joining us this morning.
Thank you.